For the longest time, mga doktor ay nagbibigay ng statins in the form of simvastatin, rosuvastatin, at maraming brands like Lipitor, Crestor, and many more, all to lower down LDL. Especially sa mga naka-low carb at naka-fasting, it is somewhat not surprising for those who are doing low carb to have elevated LDL. And whenever they go to their cardiologist, whenever they go to their doctors, automatic binibigyan sila ng statins. Others na hindi nagbibigay ng statins are also encouraging them to improve their way of eating and also telling them to stop what they're doing, especially when it comes to low carb nutrition kasi nga nakikita nila na tumataas yung kanilang LDL. However, merong bagong study na nag-publish just recently, just this week, na kung saan nakikita natin na yung kinakatakutan nating LDL is actually not something to be feared about. And also, yung promise ng statins na ito ay makakapagsalba sa atin from heart attacks, from cardiovascular diseases, from death is also not very true. So when it comes to statins, we have to consider these 5 things. But before that, this is the journal that we are talking about. So, evaluating the association between low density lipoprotein cholesterol reduction and relative and absolute effects of statin treatment. So, in this study actually, nakita nila na yung impact pala ng statin sa ating kalusugan when it comes to overall na mortality, overall effect sa buhay ng isang taong nagte-take ng statin is actually very much over-promise. Sobra-sobra ang promise ng statins as compared to the real deal na naging epekto nito sa atin. So, again, when it comes to these findings, when it comes to statins, these are the 5 things that you should consider. We should remember na yung statin use was started in CTT or cholesterol treatment trials. And now we see na yung cholesterol treatment trials na yon is actually very questionable. Bakit questionable yung cholesterol treatment trials? They are promising na kapag nag-statins ka daw, yung risk mo of death, like heart attack, stroke, will be reduced to 30%. So sobrang laki yung 30% na yon. However, we have to question this because ang gumawa ng mga research na yon are the same drug companies that are producing statins. So meron siyang na tinatawag nating issues when it comes to ethical side because they are going to be the first one to benefit from this use because they are the manufacturers, they are the sellers, they are the pharmaceutical industries in charge of these production at sila yung primary makaka-benefit nito. And when they look closely, yung mga research na sinasabi nilang pinagkunan nila ng ganitong findings is also not disclosing everything when it comes to their methodology. So that's why for the longest time, a lot of doctors have been using and just accepting statins as use and just because they see na yung laboratories nga ay bumababa yung kanilang cholesterol levels, we just accept this as is. But when it comes to end result, when it comes to eventually yung pinaka-outcome ng pagtitake, ano yung nakikita? For all of you who are watching right now, I'm sure you know at least one person na umiinom ng statins because ako nga, I was so surprised na among the doctors that I am associated with, even if they look fit, even if they look very healthy, a lot of them have been taking statins na pala for years and it's given to them as parang maintenance na and they're just accepting it as just part of their aging process. And it really disturbed me knowing that I know na statins is also not without side effects. I also know one na very close to me, even working in the pharmaceutical industry, and sila mismo umiinom din ng statins. This gives me the highlight that even doctors, even the pharmaceutical companies, even the healthcare providers also don't know how to really take care of their own health just because we've been living somewhat healthy, nag-exercise, hindi kumakain ng matamis. And the moment we see na yung cholesterol ay tumataas, we already think na we are going to need these statins. But we have to look closely again in this study for us to understand why we should think twice or consult again with our doctor to talk to them about this one. And the next part would be LDL is really not a bad cholesterol. Kasi pinagbibintangan lang siya na yung LDL daw ay nakaka-cause ng heart attack. But LDL is not created equal. Merong two kinds of LDL, the large density LDL and the small density LDL. The small density LDL, ito yung mga maliliit and ito yung mga inflammatory kinds of LDL. Ito yung nade-deposit sa mga arteries causing plaques. However, when it comes to low carb nutrition, if you are eating safe, kahit pa kumakain kayo ng taba, there might be an increase in your LDL, but this increase in LDL is mostly seen sa mga nagpa-check would be the large density LDL. And these large density LDL is not associated with heart attacks, with strokes, with dangers relating to cardiovascular disease. So LDL is only bad if ever you have no way of knowing kung small density or large density yung LDL ninyo. LDL is bad if you are having other cholesterols that are really bad, which would include triglycerides and VLDL. And those are also considered as remnant cholesterols, although the other remnant cholesterols like chylomicrons, hindi na yun nako-compute. But there is a way to compute this one. I already made a video about it, how to compute for your cardiovascular risk ratio. You have to check your triglycerides and HDL ratio. That is actually a better gauge. Mas mabuti yon for you to assess kung meron kayong heart risk of developing heart diseases if your triglycerides is higher than your HDL. Ideally, mas mataas dapat si HDL, the good cholesterol, as compared to triglycerides. And sa dyan pa lang, nakikita nyo na that LDL is actually not a significant factor when it comes to overall health. In fact, LDL is not a bad cholesterol na it is considered as essential part of our lipids, of our blood lipids. It is important for our metabolism. Importante din siya sa pagbigay ng immune system natin, sa pag-boost ng ating immune system. It is very important for cellular repair and damage. It is also an important source of our energy, especially kapag tayo ay naglo-low carb, or for others who are doing keto, that is also expected to rise. But it is not associated with risk of dying, especially na walang pagtaas ng inflammatory markers like ESR, CRP, and also pagtaas ng insulin sa katawan signified by mataas na fasting blood sugar at mataas na HbA1c. So if you want to go further, meron ding CT coronary calcium score, yun yung makakapag-indicate. Yun yung mas importanteng way to check if you have already impending risk of developing heart attacks and stroke. So LDL is not a real bad cholesterol. So that's why when it comes to statins, since LDL is really not bad, and ang concept na LDL is bad is already an old knowledge, an old thing na ngayon recent findings are proving that LDL is not to be feared about. So since hindi na nakakatakot si LDL, bakit mo pa kakailanganin ng statins for its use? And the next thing would be the idea between relative risk ratio and absolute risk ratio. Because yung sinabi sa cholesterol treatment trials that LDL lowering will, as caused by statin use, yung pag-take natin ng statins will reduce the risk of heart attacks and death by 30%. Yun ay relative risk ratio lamang. Ibig sabihin, hindi siya directly associated. Hindi yan sure na yung pag-take ng statins talaga ang makakapagpababa ng heart attacks, ng stroke. It could be some other reasons. Like say, for example, malay natin, just because you are taking statins, it's not really because of the statins that you have lower risk of developing heart attack. It might be your health-seeking behavior. Kasi when you take statins every month, every 3 months, bumabalik ka sa doktor mo, na-check up ka lahat, and that's why kapag merong problema, immediately na-address. So those are the possibilities why the 30% risk reduction is just a relative risk. And how about absolute risk ratio? Absolute risk ratio, ito yung sure na ibibigay ng statins directly as compared to the other factors. So, ang absolute risk ratio, di ba yung promise ng pag-take ng statins na sinasabi parati sa atin is just is 30% reduction when it comes to death. But absolute risk ratio, as findings in this study, is actually very, very little. So kung makikita mo dito, yung absolute risk ratio of reduction is just 0.8% sa all-cause mortality. Ibig sabihin, kapag iinom ka ng statins for years, for decades, magle-lessen yung risk mo na mamamatay ka for whatever reason by 0.8%. When it comes naman to MI, myocardial infarction, which is one of the leading causes of death sa Pilipinas and all over the world, ito yung scientific name of heart attack, okay? Medical term for heart attack. It's MI, myocardial infarction. So it will actually lessen your risk of developing that only at 1.3%. So sobrang layo yan sa 30% na pinag-promise. And lastly, ang pagde-develop ng stroke is just less than 4.4% for those na nagbigyan ng statin treatment in those RCTs. So we have to know this. I am not saying na hindi na kayo iinom ng statins, but you have to know the concept of why you are taking it and if it's a risk you're willing to take. Because not all statins are not without side effects. Meron tayong tinatawag na statin intolerance. 9.1 or approximately 10% of people who are taking statins nagkakaroon ng side effects. And these side effects can be as mild as muscle cramps, nagkakaroon ng cramps sa kanilang muscles, muscle aches and pains, also called myalgias. Yung iba, nagkakaroon ng some degree of memory problems, like parang nagkakaroon ng development of dementia, and others are also having problems when it comes to their liver. Other patients who are aware of this at alam na nila ito, and whenever their doctors are telling them to take statins, they are already, what they do is ginagawa nila yung statins, nililista nila sa kanilang list of allergic drugs, yung statins. Because yun nga, they really felt that they are not tolerant to statins. So, hindi lang yung usual na mga allergies ka na gamot, nilagay na nila yung statins sa mga gamot na hindi sila komportable or hindi sila compatible with. Because yes, statin use is not without side effects. And lastly, overall impact of lowered LDL does not actually reduce to death as seen in this randomized control trials, meta-analysis. Yung randomized control trials po, ito yung highest degree level of evidence when it comes to scientific protocols, scientific research. And this meta-analysis is a combination of 21 RCTs, 21 randomized control trials. So again, this is the new truth about statins. And when it comes to our LDL, you can choose not to worry about it, but personally, I don't prescribe statins. I already regret giving statins before to my mom. Noon, nagkaroon din ako ng panahon na nag-prescribe din ako ng statins, and there was even a time that I also took statins myself and also to my mom, and it's because hindi ko pa alam ang mga bagay-bagay when it comes to LDL and cholesterol before I discovered low-carb nutrition, before I discovered fasting, and most importantly, before I discovered that LDL is actually not really a bad cholesterol. LDL is good. LDL is actually essential as long as it is not paired with inflammatory na problems and inflammatory na mga markers as mentioned a while ago. So anong gagawin if ever you are on low carb nutrition and you have high LDL and you have your doctors telling you to take take statins? So first, of course, talk to your doctor about it. Huwag kayong basta-basta mag-decide lang. Try to ask them kung alam na nila yung bagong research na ito so that you can tell them that you will decide whether you will take the statins as compared to that not taking it, at kung iti-take mo ito ay magle-lessen ng less than 1% yung risk mo of dying from all those. And also, it's also very, very salient na nakita natin that there are people who have been taking statins for the longest time. We have family members, marami closest to us, died of heart attacks, died of stroke, died of the same things, and they are taking statins and they are successful sa pagbaba ng kanilang LDL. And that is why yung overall impact ng LDL being lowered is even questionable. So if you just want to lower your LDL, go lower it by taking statins. But sa totoo lang, lowering LDL will also not help you sa pagkaroon ng lessened risk when it comes to cardiovascular disease. In fact, there are studies also showing that reduction of LDL is even associated with more problems as compared to a high LDL without the other signs of inflammation. So again, talk to your doctor about it and try to focus on eating right and have better lifestyle para mas ma-maximize natin yung natural way of healing. And kapag hindi talaga na-maximize, hindi pa rin na-heal, then that's the time that you can ask help from medicines and other opinions of experts. So you have to know that so that your decision on what to do with yourself or if you are taking care of your loved ones, it will be an informed decision, it will be an informed consent. You also have a choice to decide kung ano yung gamot na iinumin mo. And if ever your doctor will tell you to sign a disclaimer or a certain form that you will opt not to agree sa kung ano ibibigay niya, that is also given. As doctors, even if we give advices on what to do, on what to take, pero in the end, it's the patient's right to choose kung anong kind of treatment yung kanyang gustong sundin at walang magagawa dito ang kahit sino man because it's your body, it's your health, it's your life. Kayo yung may-ari niyan. So maraming salamat everybody. I have to cut it short because I'm already late for our Q&A. We have a weekly live Q&A sa aming masterclass and I will be there to answer the questions in our community. And maraming salamat to everyone who is here right now. And shout out to Rochelle for giving me this one. This is so pretty. So the mantra always is, every day, in every little way, in every beautiful way, I am getting better and better. And I wish you the same thing. Maraming salamat po. Remember to always stay low carb so that we all stay safe. Have a good day, everybody.